Patellofemoral joint pain or kneecap pain or kneecap osteoarthritis, essentially all a similar sort of diagnosis in many ways. The kneecap, it sits in the thigh bone, so this would go up into the hip. The tibia, fibula, and kneecap sits in a tendon at the front of the knee. And the kneecap is used in this way to allow the knee to strengthen. It works like a fulcrum, improves the power of the quadriceps to allow you to stand up, run, walk, etc. Now, the articulation here is between a groove in the back of the femur called the trochlea, and the back of the kneecap has sort of knuckles or facets on it which articulate to sit within this groove. Now, patellofemoral pain syndrome or patellofemoral osteoarthritis, or all the different names that link to patellofemoral problems, relate to issues from the kneecap to the femur, one or two of these surfaces. Typically, it's on one of the facets, or a lateral facet or a medial facet of the kneecap. But what can be done about it? So people have anterior knee pain. It's been diagnosed perhaps through X-ray or through clinical examination as patellofemoral in origin. Several things that can be done, including in an arthritic situation. First of all, progressively and gently loading the cartilage and the structures behind the kneecap is important. So if it's too inflamed, if people are doing too much, they need to settle down. If they're not conditioned and they're not done enough, then they need to do a little bit more. So again, addiction assessment, usually by a physiotherapist, and a graded plan as to how you can improve this can make quite a big difference. The other thing that's worth trying at home, again this is best demonstrated in person with a physio, is to actually do some certain mobilisation, so actually wiggling the kneecap essentially. And you can do this yourself at home, where you would hold the kneecap and move it side to side. The kneecap floats essentially. When the thigh is straight, the leg's completely straight, the kneecap essentially floats off the trochlea slightly. There's fluid in the joint, there's fluid in most joints in the body, synovial fluid. That's a good thing. And just incidentally, joints don't dry out, so people sometimes get told they've got dry joints, the knee's dried out, it's crumbling, the elbow's dried out, the hip is dried out. The synovial fluid remains, and the more active you are, within limits, if you're doing a huge amount, then you can make it sore, but the more active you are, the more that synovial fluid is produced, and that synovial fluid gives liquidity, lubrication and nutrition to the cartilage in the joint. So in a knee, wiggling the kneecap, making sure the knee is moving full movements regularly can actually help to improve the pain, certainly long term. Then you work towards strengthening work to improve the strength, and the overall pattern should be that the pain reduces and you're able to function much more normally.